Good evening, everyone. Welcome, and thank you for joining us for a conversation with the American Academy of Pediatrics. I'm Becky Pringle, president of the National Education Association, the largest labor union in this country. And we are here to have a conversation about the coronavirus pandemic, which has dramatically changed the way we educate students in this country, forcing students and families and educators to navigate unprecedented challenges. I've had the opportunity to talk with lots of educators all over this country, and this is what I know. Nobody wants to return to in-person learning more than our NEA members, but we must do it safely and equitably for all students. And as a middle school science teacher myself, that's right, I taught those babies with attitude during their wonder years. I know that nothing is more central to the goal of safety than a solid medical and scientific understanding of COVID-19, the disease caused by this novel coronavirus. That's why we're all so very grateful to be working with the American Academy of Pediatrics to present this webinar. Let's begin our time together, as we always do, acknowledging that our NEA headquarters, located in Washington, D.C., sits on the traditional land served by the Nacotchunk people. And those of you around the country meet on traditional lands as well that are served by other Native peoples. We honor America's first people and all elders past, present, and emerging. And we are called on to learn and share what we learn about the tribal history, culture, and contributions that have been suppressed in the telling of the story of America. Let us now welcome AAP Dr. Beers, a pediatrician who currently serves as president of the HSC Healthcare System, a nonprofit healthcare organization in Washington, D.C. He serves on the Council of School Health for the American Academy of Pediatrics, and in a variety of other roles for the AAP, both regionally and nationally. Dr. Beers volunteers as a general and developmental behavioral pediatrician at Children's National Medical Center, where he was the medical director for the Children's Health Center. Dr. Beers also worked in public education, serving as the Chief Operating Officer, Chief Specialized Instruction, and Executive Director for Early Stages in the Office of Special Education in the DC Public Schools. For the next hour, we'll talk about COVID-19 and how it affects children and adolescents, how they get and transmit the disease, and the key steps that have to be taken for in-person instruction to take place safely. Among many other topics, we'll also talk about the way the disease affects social-emotional learning, as well as COVID-19's impact on students with disabilities. The pandemic has made it absolutely clear that as we talk about returning to safe in-person instruction, we must also talk about equity. The long-standing problems of racial and social inequities in this country demand our attention. And we must ensure that historically under-resourced communities do not fall further behind because they lack the resources for safe in-person or virtual instruction, or because we have failed to recognize or to address the impact of these inequities. We'll talk with Dr. Beers about what racial and social justice inequities look like from a pediatrician's perspective, most especially their impact on the health and education of children and adolescents. And because we have so many members who are parents, we'll talk about some of the common sense questions we have about our kids, our own kids, whether they should be skipping non-emergency medical appointments, questions about playing sports, singing in the choir, playing in the band, and engaging in other everyday activities. No matter how disruptive the pandemic has been, there is at least one uplifting constant. I hear every day about educators going that extra mile to ensure their students get what they need to learn either online or in person and to remain safe and healthy. I am so proud of our NEA members and what they have done for students that they serve. And I'm proud of what they've done to advocate for their own rights and needs through collective bargaining, on labor management healthcare committees, helping each other with professional development, and in so many other ways. Before we delve into your questions, let me turn it over to Dr. Beers to talk about the American Academy of Pediatrics and its work on the safe return to in-person instruction in schools. Dr. Beers?
Thank you very much for having me tonight. It's my pleasure to be with you and to share the work that the American Academy of Pediatrics has been doing to partner with educators around the country to make sure that our students and staff in schools can return safely. As President Pringle noted, we have been very involved in trying to make sure that the dialogue continues to move forward and takes into account the whole child's needs, as well as the staff and teachers in school buildings in order to ensure that we can return to in-person learning as soon as possible, as long as it is safe. In June, the American Academy of Pediatrics released a statement to acknowledge that a lot of conversations were going on around the country, talking about how students could return to school without taking into account the inequities around virtual learning, around access to additional challenging services that students need and get from schools, as well as acknowledging the realities of children's lives during this pandemic. With that, we came out together with the NEA to make it clear that this didn't happen without ensuring that teachers were also safe. And so I'll talk a little bit about the sort of big parameters that we put forward as key components that need to be in place to start the dialogue around safe re-entry into schools. The first and most important component is making sure that communities are doing what is required to ensure that community spread of COVID is reduced. We know from the data from around the world, as well as more recently here in the United States, that communities that have not first taken care of controlling community spread will not be able to safely reopen schools and not experience additional spread in schools from kids and teachers, as well as throughout the broader community. We also know that schools rely on very tenuous budgets, and that this does not happen with what is currently budgeted in most school districts. There are additional staffing requirements, there are additional supply requirements that need to be contemplated as we think about how to safely re-entry into school in person. Some of the things that we'll talk about tonight in a little bit more depth will be face coverings. The first round of guidance that we put out in June made it clear that face coverings need to be part of the plan that schools put in place in order to control spread in schools between students as well as between students and staff. There is good evidence out of Australia that in fact we need to make sure that the adults are also making sure that they are using face coverings, because adults are more likely to catch COVID-19 from each other than they are from their students. It makes sense and plays out in the health arena as well. We worry very much about taking care of our patients in the healthcare space. In the school space, each and every one of you teachers cares deeply about the health and well-being of each of your students. and does everything possible to keep them safe in the classroom. We take a break, we go to the break room, we meet with our peers, we take our mask off, we get too close, and that's the space that actually we are at highest risk. And so it is important to continue to think about that. Certainly, we all know that there are physical distancing issues that we want to make sure that schools are putting forward as well, and recognize that many schools can't meet the physical distancing recommendations from the CDC of 6 feet without contemplating lowering student numbers in the schools. And the final is the environment. And I know the teachers in many jurisdictions have been very vocal in making sure that there's a conversation about the lack of appropriate ventilation in school buildings. And that is often due to the lack of the long-term investments in those ventilation systems. And certainly we know that that is an issue, and certainly then the additional supplies needed to make sure that cleaning can happen. But we look forward to the dialogue tonight, and I look forward to answering questions as they come forward.
So thank you so much, Dr. Beers. I have to tell you that right after AAP issued the first statement, I was interviewed, and in preparation for the interview, I actually read what AAP put out. And the reporter said, well, you know, the AAP said, send those kids back to school no matter what. And I said, you know, I actually read it, and that's not what they said. And you know that happened, and the AAP immediately stepped up, and I can't thank you enough for partnering with us so that you could clarify the safe part of your statement, because that was being left out. We're all concerned about the safety of our students, and I appreciate you particularly calling out teachers. And we know it's not just our teachers, and NEA represents paraprofessionals and bus drivers, secretaries, counselors. We have all of those caring adults in those buildings with our students, all supporting their learning. And we have to care about them as well. So I thank you for lifting that up too. I just want to let the folks who are listening tonight know that the NEA has some really good resources on the pandemic. You can find them at educatingthroughcrisis.org. There you'll find guidance on returning to in-person instructions, really good questions you need to be asking, information on your own rights and on online learning. As I said before, professional development opportunities, so much more. So please go to educatingthroughcrisis.org. You know, we received, Dr. Beers, we received over 100 questions from those who registered for our webinar tonight. We certainly will not have time for all of those questions. We're going to answer as many as we possibly can, but I want to assure our listeners that we will follow up with a question and answer document that will address all the questions that we've received already, and those we'll receive tonight. Feel free to use the Q&A function during the webinar to submit your questions, and we will get to every one of them, not necessarily live and in person tonight, but please check out our website and you will get that Q&A so you have your question answered. Also, I want to let you know that we're recording this conversation, and that will additionally be available at that site, educatingthroughcrisis.org, so you can share it with friends, family members, and other educators. So Dr. Beers, let's just start our conversation here. So every day, it seems there are new studies coming out about the coronavirus and COVID-19. It's hard to keep up with all of it. And so many times it's contradictory. So that's very challenging for us as educators and as parents. It's clear, though, that children and adolescents can get and transmit the disease. So what do we actually know about children and adolescents and the disease compared to adults, and what's different for them as it relates to the severity of the illness and how they can transmit that virus to others?
Sure, and as you note, there have been lots of children and adolescents who have gotten to COVID-19 here in the United States. That number has topped over 500,000 young people who have tested positive for COVID-19 since we've been testing. We know that there are probably more children than that because certainly early in the pandemic, testing resources were limited and testing of children was not prioritized because of early data that came out that suggested that children were less likely to get disease and certainly less severe disease if they did get it. Much of that continues to be true, which is that children do get disease. When there is large-scale community spread, you will see children who have symptoms. When you look at that testing, whether that's here in Washington, D.C., or in Florida, or in other jurisdictions, for symptomatic children, kids who are having cough or fevers, GI symptoms, somewhere around sort of 20 to 30% of those individuals are testing positive if they are coming in for symptom-based testing. That's consistent with a lot of what we've seen around this country as we've done more testing in children. What we do know, and there's good documented evidence now, is that children are less likely to have severe symptoms. They are less likely to die from COVID-19, but they are also less likely to get hospitalized. They also are less likely to spread disease, though as adolescents grow and get bigger and are more like adult-sized, they are more likely to spread it more similarly to adults than younger children. And so the study out of South Korea started to document that, in fact, younger children expel fewer droplets and are less likely to spread it amongst family members. The data that's still missing that we all wished we had was that data about what's going on around spread within schools. There is some data out of both Germany and France that does suggest that, in fact, the spread in schools is less amongst kids, even those kids who are moving through the building, as long as they are putting in place those precautions that we talked about, making sure that they're wearing face coverings, making sure that, in fact, they are physical distancing as much as possible, and that the surfaces that are frequently touched are getting cleaned on a regular basis. There's some new data that's just, I talked with some folks in Florida that seems to suggest that even in those cases that have appeared in schools, where there has been a single case in a school and they've had to send other kids or staff home, that they have not had secondary spread to other individuals in the situations where all of the parties were wearing face coverings. And so I can't reemphasize that enough. And we have to get away from the political battle that is going on around face coverings, because we can now have much better understanding. I have to admit, a slow adopter of face coverings this spring, given what we knew about the fact that I wasn't going to be wearing an N95 all day long. So when I'm not seeing patients, certainly when I'm seeing patients, I was masking appropriately. But now that we understand that cloth face coverings can be effective in helping us reduce spread and have that data, we should be using that data to make good scientifically based decisions about how we reduce the spread of COVID-19 in our communities.
Thank you. Thank you for that comprehensive answer, Dr. Beers. You know, we often hear cases or evidence cited from other countries, and they say that first part, that they're in school and things are going okay, and they leave out that last part that you talked about, as long as they are following all of those guidelines. So we really appreciate that. So Dr. Beers, we have Peggy, a question from Peggy, a member from Idaho, and she submitted this question. Can you speak to the long-term effect of this disease, that this disease may have on children? We've been hearing a lot about long-term effects on adults, and we hadn't heard as much about those long-term effects on kids who get the disease and get ill, but maybe not seriously, but have long-term effects. Can you talk a little bit about that?
Sure. I mean, I think this spring we all heard about this multi-system inflammatory disease that kids may get, which is sort of a post-infectious inflammation in the body that certainly seems to be unique to children. It's not as common in adults, but does cause more severe symptoms. It still is a very small number of children who do get that inflammatory response. When we talk about the long-term effects in children, this is an area that we continue to study and understand. There are some longitudinal studies out of Boston, as well as here in DC at Children's National, to look at what is the impact on children over the long term. What we do know is those who have significant lung disease, right, which is, again, less common in children, but as children get older, may be something that they experience more of, that we do know that they can have prolonged impact on their respiratory status, their ability to adequately breathe, to get enough oxygen in, to transfer that oxygen into their body, that continues to be something that can take a significant amount of time for people to recover from. And certainly the adult data suggests that can take months so far for people to recover from. And so I think those are pieces that we will continue to understand better as we continue to follow this disease, and continue to do some of the studies around understanding how many kids actually have it. Here in DC, we are doing what's called seroprevalence studies, where we're doing the blood tests to see how many people did have COVID in our communities, and that will help us also start to understand the long-term sequelae and what types of things we need to do in order to help support those kids and young adults recover.
Thanks. That's encouraging that all of that research is going on. And I do appreciate you using that example of a child that might have a respiratory problem. It's something that as educators we're also fighting for, is ensuring that all plans to return to in-school learning include addressing the fact that some of our students have pre-existing conditions. So thank you for lifting that up. So, Dr. Beers, the AAP is absolutely clear that for in-person learning to take place safely, it is crucial for communities to take all necessary measures to limit the spread of the coronavirus. And we've been talking a lot about that. First, the rates need to be down, and it's all hands on deck. All of us need to take responsibility for making sure that happens. What are the 5 most important things that must be done in schools to try to achieve that goal?
Clearly, if I haven't said it enough already in the last 20 minutes, it is using face coverings. We know that this is a strong strategy both in of schools and out of schools to ensure the safety of our students as well as the staff. In addition, physical distancing is a great way to help decrease that spread. There's a great little trick, and teachers always have great tricks, I know, having worked in a school system and learning a few from many of them. But certainly, if you have students go sort of in airplane mode, where they sort of hold their arms out horizontally and go knuckle to knuckle, as long as they can't touch each other's hands, they are essentially between 3 to 6 feet apart. Adults are really 6 feet apart. Students may be a little bit closer, but it's a good strategy to have people be sure that they are spread far enough apart. In addition, there need to be clear cleaning protocols in place for high touch areas. So doorknobs, desks, making sure that those are part of regular cleaning. And that may be cleaning in between classes if students are changing classes. It also is some spaces that schools probably don't think about cleaning regularly. We all know that probably those outside handles going in and out of schools, or the railings up and down on the stairs in and out of schools, are probably never cleaned. But right here, right now, we know kids swing on those, they hang on them, they lean on them, and they need to be part of our cleaning protocol. So there's some spaces that we don't normally think about that are critical. And then the last thing that I will note is that it is really important that we think about how do we increase the ventilation in our schools. And so where possible, certainly thinking about leaving classroom doors open if possible, windows open, thinking about outdoor spaces to provide education as possible, knowing that can't happen all year long in many parts of the country, but certainly those are all strategies that we need to think about in order to reduce the spread and keep everybody safe, students and teachers and staff alike.
So thank you. And as educators, we know that we have to repeat things over and over and over again for learning to occur, whether we're talking about children or adults. So I appreciate you continuing to talk about face coverings, masks. And our next question actually is about masks. And this one comes from Naomi in Massachusetts. And she says that our district would like to give students a 10-minute mask break during class. Is that too long of a time for 15 students to have masks off inside? Or is there an acceptable amount of time?
So I think there are several ways to think about this. Certainly we know that wearing a mask for 8 hours a day is a challenge for any of us. Having done it at work myself, I know the challenge that exists. And certainly for younger children, it will be more challenging. And so building in regular mask breaks into the school day so that there's an expected time that students can actually remove their masks and do it safely, as opposed to having them take them off at times where it may not be the best time to do it. There's some criteria and some guidance that should be thought about as we think about breaks. As I said earlier, outside is better than inside. So certainly if you could do it outside and be physically distanced, that's going to be better than inside the classroom or inside the building. Certainly we want to think about maximizing the physical distance between individuals if we are going to be unmasked. And that is important as well. And so you want to make sure that you're at least 6 feet, but greater distances is important as well. In addition, you want to make sure that that period of time where you are giving masks breaks is not a period of time of extreme physical activity or singing or playing instruments or things that will cause you to expel air at a greater rate or greater amount. And so you want to make sure that it is a calm, quiet time, not a run around and being wild time. And then finally, you want to think about, are there individuals in the class who are at greater risk, either the teacher or other staff or students, who should be removed from that space while other students are getting a break, so that they are not put into undue risk. And that is an important component of thinking about how you do it safely. Now, the CDC guidance around what's an actual exposure is 15 minutes of time with someone within 6 feet of them. So if you can do the spacing and have it be less than 15 minutes, it certainly can be safe. But again, we want to make sure that all of those other parameters are thought about to really optimize the capacity to reduce risk to everybody in that space.
So let's stay with the mask because we had other questions about that. We've also heard schools saying that it's okay for students, excuse me, to be without masks as long as they're facing forward in their desks, excuse me, which seems to run contrary to much of what why wearing masks is so important. Excuse me, please.
No problem. Yeah, let me jump in, and if I got it wrong, you'll let me know.
While I lurch for my water here.
Yes, please do. Certainly, we in the American Academy of Pediatrics did talk about sort of facing desks forward instead of having them grouped in small groups, right? We all know the trend lately has been to try and create little pods within classrooms where students can work together and collaborate together and learn together. And that has been a great learning opportunity in many classrooms. And so you'll see from the AAP as well as others, you'll see that Italy had to go out and buy all new desks because all of their desks are pod desks. They had no desks in most of their classrooms. There were individual desks that could be reshuffled and focused forward. And so certainly facing forward in rows is going to reduce risk. It doesn't negate the need to wear face coverings, however. You still need to use face coverings, even if the students are facing forward, because just because you cough in the back of my head doesn't mean that those droplets don't come to the front of my face and become something that I could be exposed to. And the lateral exposure when I turn my head means that the kids next to me are exposed as well. And so we still recommend face coverings, even if students are all facing forward.
Thank you. Thank you for clarifying that. So we're going to hear a question from one of our members, Helen Jacobs. You know, as I said before, our schools are much more than our classrooms. Many kids take buses to and from school. Helen Jacobs is a member from Albany, Oregon, and president of the Greater Albany Association of Classified Employees. And she has a question about school buses. Helen, are you there?
Yes, I am. Thank you for this opportunity. I train school bus drivers in our town. My question is this. First, it's cold, rainy, and windy during parts of the year, so keeping windows open even a little bit could be a problem. With windows open, even with the heat on, some kids are going to be hot, some kids are going to be cold. We also will be out in the countryside with dense fog and windy roads. So getting our students loaded as quickly as possible is critical. Due to COVID-19, we're supposed to do a general check for masks and to see if students are sick. If the students are sick that we believe to be sick, we are to see if parents can take them home, and if they do not have anybody at the stop, we're to put them on the bus and keep them 6 feet apart from the other students. With these complications, how can we safely transport students to school?
Well, first, thank you for everything that you do and making sure that our kids can get safely to school, and that the staff who are supporting them have what they need, and to understand that. So thank you for doing that. It is a really hard question. I think certainly school districts are handling this in lots of different ways. What we are clear as the American Academy of Pediatrics is that there will be students who get onto the bus who the bus attendant or bus driver knows are sick. And yet there is either not a parent or not a willing parent to take them back home, and that leaving the child on the side of the road is not a viable option. And so it is about how do we keep everyone safe in those situations. The good news is that if we can ensure that students and staff on the bus are using face coverings, again, it will help reduce the risk to others. There is data, as I said, out of Florida, but also out of healthcare systems that shows if both parties are using masks, the risk of actual transmission is low enough that we may be able to contemplate in the near future discussing not having to do self-isolation for as long or at all in the future as we sort of move forward based on the new data that we gain. So one, making sure that that child who is sick does have their own face covering on, and that the other students and staff who are on the bus have face coverings on as well. Certainly, if you can isolate that student by separating them in a greater physical distance, that's going to be helpful as well. And then finally, making sure that that student is connected with someone at the school who can monitor their health and keep them contained and isolated until an adult can come and pick them up and take them home. Many school districts are actually having families reconfirm their understanding that they must come get their child if their child does get sick at school, and that they must keep their child home if their child is sick prior to coming to school. It doesn't mean that there aren't going to be children who show up at that bus stop who aren't sick, or show up in the building who aren't sick. And so making sure that the plan has both a protocol in place that everyone understands, and that there is notification of the parent as well as the other parent. I, as a parent, want to know if someone else got on that bus who happens to be sick. And so making sure that those protocols are in place so that the staff, as well as the other parents, have been informed of a sick student or a sick staff member for that matter.
Thank you, Helen, for that question, and Dr. Beers. And I want to highlight something you said in your answer, Dr. Beers. Plan, really important. It's really important that you have one and that it is communicated, and that in the development of that plan that the educators, the parents are working in collaboration with the school districts to develop that plan, and everyone knows what it is. So I appreciate you lifting that up as well. You know, our members have submitted lots of questions about social distancing. The AAP has referred to 3 feet in some contexts, and we hear from many sources that 6 feet is more appropriate. Can you help us, Dr. Beers, understand the different recommended distances?
Sure. The CDC has recommended 6 feet distance and continues to make that recommendation. The AAP did look at that data as well as data from the World Health Organization related to other pandemics, as well as what some other countries have been able to do around return to school, and acknowledging that many schools, if you're going to maintain 6 feet of distance between students and staff and all of the people in the classroom, couldn't have more than 50% of those students in the class at any one time, just given the physical constraints that exist in the building and in those classroom spaces. And so as you think about that data and you think about what actually has been successful in other countries, there have been other countries that have been able to do that with 3 feet. However, I will go back to the same thing that I keep saying, which is that has in place face coverings, as well as clear cleaning protocols and screening protocols for students and staff to make sure that sick students aren't in those classrooms, as well as making sure that everyone is protected while they are in the classroom.
So thanks for clarifying that, Dr. Beers. You know, the bottom line is that the CDC is saying that 6 feet of distance between people is what's appropriate. And I know the AAP, as you explained, makes it clear that that's what we should be shooting for, particularly given how complicated it is to put in place other protective measures due to the budget constraints you just talked about. I don't know any school district that had coronavirus budgeted line item. And local variations in ventilation, which is another big, huge issue, particularly in our schools that have been standing for over 50 years, as well as the enforcement of mask requirements, which you've talked about over and over again. I just want to let our listeners know that NEA believes that maintaining at least 6 feet of distance remains a very important safety measure. And as you spoke about creativity, Dr. Beers, we hear educators and administrative school boards all over the country trying to think about how they can create more space by going outside and those kinds of things. So that's what we're shooting for, and we want that to be clear with our members. So what concerns should schools, parents, and educators expect as it relates to social emotional learning and the mental health needs of our students, and how can we prepare to meet those needs, whether it's in person or remote learning?
Sure. I mean, the NEA knows as well as anybody that so many of our students rely on schools and staff in schools to get social emotional support every single day. And so during this pandemic, either in virtual space or in person, those students still have those same needs that they had 9 months ago. The reality is that we have all gone through additional stress and trauma during this pandemic. Whether you have experienced loss directly in your family, whether a student has experienced loss in their family, or people who in their family have lost jobs or been exposed to or victims of violence, all of those are additional stresses and strains that our students have been experiencing, and that we can expect to show up in lots of different ways for teachers and staff in schools. And that may be the student who's struggling to pay attention in class. It may be the student who used to have some behavioral issues and has regressed with some behavioral behaviors that had mostly gone away. And it may be new behaviors that a child is experiencing. And so certainly teachers have been at the front line all along in identifying those needs of those students and helping to get those supports. The AAP believes strongly that there will be additional mental health support needs that are required in schools if we are going to successfully support students. I will also note that in our statement, we also clearly delineate that each and every one of you as staff in schools have experienced your own stress and trauma. You may have your own anxiety about returning to school, or stress or strain in trying to provide services in a virtual space. All of that needs to be addressed as well. And support for staff and teachers in schools has to be part of the plan, because we can't expect you to take care of our children if we're not taking care of you as well. And so we felt it was necessary. It's outside our lane. We fully acknowledge that. But we believe strongly in caring for the whole child, and that can't happen if we aren't addressing the adult needs in the building as well.
So Dr. Beers, we appreciate you going outside your lane. We talk about that all the time, and not only, you know, as a caring society, should everyone be saying what you just said, but just the reality, if our teachers and our support staff are sick, or if they are suffering from trauma, then they can't teach or care for or nurture our students, or feed them, or drive them to school. Thank you so much for saying that. You heard me talk about this at the beginning of my remarks. I talked about the racial and social inequities that have forever, honestly, undermined education and educational opportunities for Indigenous and people of color and the economically marginalized. The pandemic has, as you know, called attention to institutional and structural racism across systems, from food insecurity to housing insecurity to the inequities that we see directly in our school systems. But a lot of work remains to be done to move overcoming it. Can you talk a little bit about what the racial and social inequities look like from a pediatrician's perspective, and their impact on the health and education of our children and adolescents?
Sure. I think this is a really important issue. The AAP feels strongly that we need to dig in deep and address the issues of racial inequity and social inequity in our society and the impacts that they have on children and families. And so certainly, as you know, the pandemic has exacerbated a large number of those issues. We have significant numbers of families who rely on schools for free and reduced lunch and breakfast programs, and sometimes supper programs, with over 30 million children in the United States relying on schools for adequate nutrition. With the closure of schools, many school districts tried very hard to think of creative ways to make sure that students could get adequate nutrition by opening their schools to provide pickup opportunities, to using their school buses to make sure that they were going out and supporting families who might not be able to get in to schools, but to get them closer to their homes, to even having lunch staff and food staff hand deliver meals because they knew students who would typically be in getting meals were not coming in to get them. And so people have gone above and beyond on the food side, but we still see huge numbers of children across this country who are not getting adequate nutrition during this pandemic, even with all of those efforts in place. And certainly we are pleased that the USDA has extended the ability to continue to provide some flexibility around school meals during this period of time. but it is going to take more than that to address those long-term systemic inequities that exist, because it also has to do with how our communities are set up. What we know is that our Black and Latinx and Indigenous populations are more likely to live in food deserts. They are less likely to have adequate nutritional choices in their communities that are easily accessible and affordable. And so all of those issues come into play. And certainly each and every one of you know, if a child is not adequately nourished, they are not going to appropriately learn. And so we have to be willing to work and address that issue together. We also know that the pandemic has highlighted the digital divide, that the experience of Black and Latinx and Indigenous students has been much different than it has been for white or high income families. Those individuals have been able to access usually readily the distance learning opportunities, whereas Black, Latinx, and Indigenous populations have struggled at a greater degree of having adequate numbers of devices, having appropriate spaces to learn in their houses, as well as having appropriate internet connection that allows them to maintain connection adequate enough to actually do virtual learning. And so that has been another issue that has come up. And then certainly we know that our Black and Latinx and Indigenous populations are more likely to be frontline workers, where they are hourly employees, where they are less likely to have been afforded the opportunity to take time off. They're higher risk for exposure to COVID, they're higher risk for complications to COVID, and they don't have the choices to ensure that their children are getting adequate supervision and support during the school day. And so those are all components that need to be addressed, and we need to continue to press and challenge our society to figure out how to address those systemic racism issues if we are going to be able to support students in this virtual space. Because each and every one of you know about the summer slide and the reality of slippage in education that happens just in a 10-week period. And we are now already tacked on 12 weeks of virtual learning this spring and are entering into another virtual space for many jurisdictions in this country. And that is going to exacerbate the gap in education that exists between those who have and those who don't, as well as the racial inequities that exist. And we can't continue to allow that to destroy another generation of children.
So I really appreciate that comprehensive answer, and I look forward to our continued partnership in this. We need your voice. Certainly your members see it every day. Before the coronavirus pandemic, you saw the disparities. And for all the reasons you said, we know that our children in those historically under-resourced communities are going to come to us with pre-existing conditions because of all the things you just said. So the fact that they will be more susceptible to getting the disease, but also to having severe complications from it is another issue that we continue to talk about and make sure that, you know, I said at the outset, you know, I'm so proud of our members that we're standing the gaps for students, but one of the things that we're challenging them to do is, even as they're at the table and they're making decisions, they're making plans, and everyone knows that these inequities exist and have forever, that not only are we making plans to address these issues right now, but you said a key word, Dr. Beers, and that was systemic. We cannot possibly just focus on right now. We've got to lift up our heads, and we have to solve these problems long term. So every decision we make right now has got to be grounded in solving these problems from a systemic way and from a way that it crosses those systems, so that the structural racism is addressed as we address these short-term concerns with our kids. So thank you for that answer. We have a question now from Isabel. Isabel Hernandez Canta, who teaches music in Montgomery County, Maryland. She's a member of the Montgomery County Education Association. Isabel, Thanks for joining us this evening.
Thank you very much. I have to say, you've mostly answered my question, but I guess it bears emphasizing. I teach at a school that's majority Black and Hispanic students. We have, to the best of my knowledge, already lost 5 parents to COVID. So, we've talked a lot, and there's been a lot of coverage about how hard this pandemic is hitting Black and Brown communities, adults and children. And I mean, you mentioned it, but a summary is always great, especially to the higher ups, about the extent of this, why it's happening, and considerations as schools like mine move to reopen. Thank you.
Sure. Again, thank you for everything you do. Music is such an important part of the education of our students, and supporting them to make sure that they have a truly comprehensive education is really an important part of the educational process and experience for all of our students. So thank you very much. Yes, I mentioned a little bit. I can't sit next to the science teacher and not give the scientific reason. We do have better understanding of some of the reasons why Black and Latinx individuals from a scientific perspective are more likely to get COVID and more likely to have complications of COVID. There is a receptor in our bodies called the ACE receptor. They do occur in higher numbers in Black and Latinx communities. They also occur in higher numbers in adults versus children, which explains a little bit why children are a little less susceptible. And so we do have that scientific understanding. What causes that is certainly some of the issues that we were talking about. The exposure to environmental pollutions mean that I'm more likely to have asthma. The exposures to poverty and traumatic stress means that my body is more likely to ramp up and have higher levels of ACE receptors in my body. And so certainly all of those systemic racism issues that are experienced by Black and Latinx and Indigenous populations do give us some understanding as to why there may be increased rates in those communities, as well as poorer outcomes. However, there are also some other components that are important to consider, and certainly there may be some reluctance to go access services, certainly in our Latinx community, if the individuals, even those who are documented, may have reluctance to go in because of targeting that is occurring around agencies that may harass them around their documentation status. And so there may be reluctance to go in. Certainly we know of the systemic racism that has occurred from the medical field towards Black communities. The experimentation on Black communities creates distrust of Black individuals of the healthcare system. And so a willingness to go in early has certainly been part of the issue that has caused increased complications. And so certainly as a staff member who is aware of students or family members who may have symptoms, encouraging them to go get testing done, encouraging them to go access care is important. And then the final thing I'll say is that remembering that many of these individuals who live in poverty or near poverty are also in situations where they are hourly workers. And if they don't go to work because they are sick, they are unable to get that income. And certainly that means that they are at risk for not going in early because they want to continue to maintain their income and keep their family safe and secure. And so all of those pieces play into the experience that we are seeing in Black and Latinx and Indigenous communities across the country. And certainly right here in Washington, D.C. and Montgomery County as well, even one of the richest counties in the country is experiencing those types of inequities as well.
Thank you, Dr. Beers. We have another question from one of our participants, Dina Cruz. Dina is a literary coach in Florence, South Carolina, and she's actually one of our association leaders too. She's the vice president of the South Carolina Education Association. Dina?
Good evening, Becky and Dr. Beers. Thank you so much for accepting my question. And my question revolves around immunizations. Regarding the fact that we are dealing with this pandemic at this time, would you recommend that parents continue with the scheduled immunizations for their children? And a second part of this question is, do you recommend that children and adults get the flu shot this year?
Mm.
Thank you for the opportunity to talk about immunizations, and thank you for everything that you're doing to support our students and making sure that they are learning to read, because we all know how important that is in this process. The American Academy of Pediatrics strongly believes that children should continue to get their immunizations. Pediatricians around the country are still open and serving patients all the time, and they are able and willing to provide those immunizations. The reason why maintaining the immunization schedule is important is because it will be a horrible shame if we return to in-person education only to start experiencing outbreaks of vaccine preventable illnesses because families have been reluctant to go get those immunizations. And so pediatricians around the country are trying all kinds of novel strategies. Some people are offering immunizations out in their parking lots, under tents. Some people are going to people's homes to provide immunizations, but we recommend that you contact your pediatrician to make sure that you are maintaining that immunization schedule as appropriately as possible. The flu vaccine is even more important this year than it is every single year. And here's part of the reason why, which is symptoms of the flu and symptoms of COVID look almost exactly the same. And so a child who may have the flu will also cause a school to go into COVID mode and have to determine whether or not it is COVID or not, and who needs to be isolated and who doesn't, and all of those components just as much as they would if that child only had COVID. So it is incredibly important that both students as well as staff and teachers all get the flu vaccine this year to help minimize the confusion that exists. We also do know that students, that we have seen cases of individuals who had both the flu as well as COVID. And so we want to make sure that we don't confuse the situation as much as possible, and that we keep everyone as safe as possible during this period of time by protecting them for everything that we can protect them from as safely as possible.
Thank you, Dr. Beers. One last question. We know that the coronavirus creates all kinds of challenges for our students with special needs. We know that you work on this issue in your work in public schools. Can you talk a little bit about those challenges and how we can overcome them?
Yeah, so I think there's a couple of things that are important to put forward and have people think about. Every child who has a disability is not at higher risk for COVID. Even a child who is on a ventilator may not be at higher risk for COVID. And so it is important to step back and think about what the underlying disease is in that child and whether or not it puts them at higher risk when we think about what's the strategy around supporting students with disabilities in our schools. That is really critical. The second piece that is important to know, right, is that we all know about IDEA, or the Individuals with Disabilities Education Act, and the rights that students with disabilities have to free and appropriate public education. And certainly this period of time in the pandemic has been challenging for everyone, and our students with disabilities have fallen further behind because we weren't really prepared to figure out sort of how to provide all those services. And yet there have been amazing stories of really great work that school districts and teachers in particular have done to support students with disabilities, to make sure they had access, to make sure that their families had support that they needed, to make sure that they were connecting to services. But we have to start thinking creatively about how we deal with their health issues as well as how we deal with their educational issues. And so working together with families to prioritize what the goals are. Every single goal that's on the IEP may not be the priority right now. And so working together with families to think about what that priority that the family has and that the student has, so that we make sure that we are supporting them as effectively as possible. Making sure that we are making space for the family to have dialogue around what works best for their student. That student may do better at certain times of day. They may do better in smaller amounts of time. All of those have to be part of the conversation, whether we are in person or doing virtual learning. And if we are going to be doing virtual learning, thinking about how we can leverage some of the health resources to potentially get some of those critical therapies that students are relying on, like physical therapy or occupational or speech therapy, to make sure that those who do qualify can get those covered by their health insurance and have home-based services to ensure that those students aren't put at higher risk for long-term complications from their disability or fall further behind. But certainly teachers are thinking creatively in this space and partnering together with families and students to make sure that we support them as much as possible.
Thank you so much, Dr. Beers. I could talk to you all evening, and I'm sure our members could listen all evening. You have so much information, and I know that you'll be working with us to answer all of those questions, so we really appreciate all of that. It has been a pleasure talking to you this evening, and as educators, you know that we're all about continuous learning, so we really appreciate you taking time to share your expertise and your experience, your insights to help inform our thinking and the decisions that we need to make to keep our kids safe. And thanks to the American Academy of Pediatrics for working with us on this webinar. The challenges we all face in safely and equitably returning to in-person instruction demand medically and scientifically sound information and guidance. We have so much more work to do, but you've helped us move forward. So thank you. And thanks to all of you who joined us for this webinar. Again, I want to remind you that this recording will be available on educatingthroughcrisis.org, where you'll find all of those resources that I talked about earlier in this webinar. So thank you all for joining us. We ask that you take care, you stay safe, and good night. Thank you.